Hello and welcome everyone to your own channel pharmaSID. From today onwards we are going to discuss on the video lecture series on the subject of hospital and clinical pharmacy. So let me just make you know that what are we are going to study in this video lecture series is. So let's just begin. In this video lecture series we are going to discuss on hospital and clinical pharmacy. This subject is based on two parts. First one is hospital pharmacy and second one is clinical pharmacy. In hospital pharmacy, the topics are as follows. First one is a hospital. So what are hospital? Its definition, function, classification based on various criteria, organization, management and health delivery system in India. The second chapter is hospital pharmacy. In hospital pharmacy, we are going to discuss its definition, functions and objectives of hospital pharmaceutical services. Location, layout, flowchart of materials and menu. Personal and facilities requirements including equipments based on individual and basic needs. Requirements and abilities required for hospital pharmacies. Our next chapter is drug distribution systems in hospital. There are two services provided, outpatient services and inpatient services. In inpatient services, we are going to discuss types of services, detailed discussion of unit dose system, fluid ward stock system, which is very important. We are going to discuss in detail satellite pharmacy services, central sterile services and bedside pharmacy. Bedside pharmacy is very important, highlighted, and we are going to study it later on. Our next chapter is on manufacturing, its economical consideration and estimation of demand. Why manufacturing is very important in hospitals. Our next chapter is on sterile manufacture. It contains large and small volume parenterals, facilities, requirements, layout, production planning and manpower requirements. In this also we are going to discuss non-sterile manufacture, its second part. It contains liquid orals, externals, bulk concentrates, procurement of stores and testing of raw materials. Our next chapter is of nomenclature and uses of surgical instruments and hospital equipments and health accessories. Okay, and our next chapter is PTC, Pharmacy and Therapeutic Committee. It's a very important chapter. We will discuss it later on. Next chapter is hospital formulary system and their organization, functioning and composition. Our next chapter is drug information services and drug information bulletin. Next we will discuss surgical dressings like cotton, gauze, bandages, adhesive tapes, including pharmacopoeial tests for quality. Other hospital supply, example like IV sets, BG sets, water vials tube, catheters, syringes, etc. And last but not least, our very much important topic is application of computers in maintenance of records, inventory control, medication monitoring, drug information and data storage and retrieval in a hospital retail pharmacy established. We all know that computers in day-to-day life are very important, and how they take importance in hospitals is very much interesting, and we will discuss it later on. Our next topic is of clinical pharmacy. First topic is introduction to clinical pharmacy practices. It contains its definition and scope. Our second chapter is modern dispensing aspects. It contains pharmacist and patient counseling and advice for the use of common drugs, medication history. Our next topic is of common daily terminologies used in a practice of medicine, which is very important, and we have to discuss each and every terms in detail so that we can memorize it very well and use in the examinations. Our next chapter is of disease manifestation and pathophysiology, including silent symptoms to understand the disease like tuberculosis, hepatitis, rheumatoid arthritis, cardiovascular diseases, epilepsy, diabetes, peptic ulcer and hypertension. Our next chapter is physiological parameters with their significance. Next we will discuss drug interactions, definitions and introduction, mechanism of drug interaction, hypoglycemic agents, drugs used in analgesics, diuretics, cardiovascular drugs, gastrointestinal agents, vitamins, and drug-food interactions. Next, and very important topic, this is adverse drug reaction. We all know that, and its introduction, general treatment of poisoning, systemic antidotes, treatment of insecticide poisoning, heavy metal poisoning, narcotic drugs, barbiturates, organophosphate poisons. Next, we will discuss drug dependence, drug abuse, additive drugs and their treatment, and the complications which are there in this treatment. Next, very important chapter, this is bioavailability. We now all know that what is bioavailability, but we will discuss what is bioavailability also and the factors affecting bioavailability.